Hi everyone, I'm Gary Knoll. Nice to have you with us where we're here to talk about health and nutrition issues. Today, once again, we're taking our camera out on the road around the world to show you about one of the most important and fearful topics we know of. But maybe after watching this, you won't be so afraid. It's about cancer and all the natural approaches, both the causes of cancer and non-toxic alternative treatments. Join us now as we explore alternative approaches to cancer.
Genetics has little to do with breast cancer in adult women. Only about 5 or 7% of all cases are related to true genetics. What we're seeing, though, is that women and men learn behaviors from families. If you eat a high-fat diet as a child, you're likely to continue that and handing that diet down to your children. If you see smoking and drinking in your family, you learn that behavior and you'll also hand that down to your own children.
The idea of doing preventative mastectomies in women, especially young women, that shows a gene that predisposes them to this particular illness is very radical and very unbalanced. The gene is just an indicator that a person is predisposed or has the possibility of developing this illness. If anything, it should be an alarm that goes off to change their lifestyle in order to prevent the development of this disease.
Prostate cancer is very similar to breast cancer. Is developed by the same factors, dietary factors, a high-fat diet, high cholesterol, low fiber, little or no vitamins and minerals, smoking, alcohol. The same risk factors that go into cause breast cancer are very similar for prostate. Prostate cancer, in fact, behaves very similarly to breast cancer. It is hormonally responsive when treatment. Chemotherapy has almost no effect on it. And men, if they want to protect their prostate, should modify the major risk factors right from the beginning. Lower the fat content in your diet to a less than 20% level. No cholesterol-containing foods. Increase the fiber foods. Increase antioxidants and B vitamins. Stop smoking. Stop alcohol. Learn to exercise. Learn to relax and modify stress. That will help protect your prostate.
I tell my patients there's what we call 6 cancers of affluence. Now maybe there's more, but these are what I talk about, which I believe are related to the high-fat diet. Prostate and pancreas in men, ovaries and uterus in women, breast cancer in women, and colon and rectum in men and women. It's almost equal in men and women. And if we look for a little more proof for that, let's go back to Japan. Japanese women have a very, very low incidence of cancer of the breast. It's about 1/5 that of American women. And when I say American women, I mean just American citizens, American women, whatever their national background has been, it doesn't matter. When the Japanese women come to this country, it doesn't change for them, but their daughters have an increased incidence of cancer of the breast, and their granddaughters are just about like everybody else. So what we're talking about is a national diet. So one thing we can do is to definitely reduce the kind of fat in our diet. Eating more of the monounsaturated fats, eating more vegetables, fruits, grains, peas, beans, and lentils, and less of that processed food.
From the standpoint of Ayurvedic medicine of India, we say that cancer comes about from a tamasic or stagnating personality and diet style. If the diet is stagnating, this means if the diet is too rich, too salty, has too many heavy foods in it, foods that are denatured, foods that aren't vital, then the person tends to degenerate, and one of the degenerations can be cancer. The Chinese system says the same thing. The Chinese system classifies cancer as a damp, stagnant condition. And so they see that what we need to do to overcome cancer in almost every case is to overcome dampness. And by dampness we mean, in the scientific standpoint, we would mean, say, accumulations of fatty, moist material in the body that form tumors and cysts and so on.
There are a number of studies that seem to say that vegetarians and those who follow a more or less macrobiotic diet may actually have a lower predisposition to cancer, and also those that have cancer may do far better in terms of survival rates if they consume a macrobiotic or vegetarian type of diet. And there are several reasons why this might be so. Both of these types of diets are very high, obviously, in vegetables. And specific vegetables known as cruciferous vegetables, which include broccoli, cabbage, and cauliflower, have specific known anti-cancer chemicals. One of these chemicals is known as indole 3-carbinol, and there are other types of indoles as well that Harvard really has done the groundbreaking work in terms of cancer prevention. So high levels of these chemicals, which would be found in macrobiotic and vegetarian diets, are obviously desirable. Also, vegetarian and macrobiotic diets are very high in soy products. And more recently, the scientific community has been looking at specific chemicals in soy, these phytochemicals like isoflavones, which have known anti-cancer effects. So it's probably the large amounts of these chemicals in these diets that also offer some benefit.
If you look at what's in the grocery store today, about 30 to 40% of the listed ingredients are not recognized by the body as food. It's recognized as chemicals and processed elements that the body needs to get rid of. And that really puts a big stress on the metabolism of the system, the liver, the kidneys, as well as the other organs of detoxification. And that takes away from the body's ability to prevent cancer, or if you have cancer or any other chronic disease, to fight the disease. So we really do recommend that people eat a diet, a pure diet, which means, by the strictest standards, organic foods. And even with organic foods these days, we can't ensure total purity because we've messed with the environment so much that we have acid rain, that the oceans are polluted, but we have to do the best we can. And that means using pure water, organic foods, and paying attention to the types of foods we eat.
Soy products are, I think, extremely important in both the prevention and the treatment of cancers, particularly hormone-related cancers. Soy products contain phytohormones, or chemicals that resemble hormones found in our bodies. Isoflavones are one such type of chemical, and they actually help modulate or modify estrogen and testosterone. And many types of cancer, for example, breast cancer, is definitely related to an abnormal hormone balance. So if a woman, for example, consumes a good amount of soy products, they'll get a good supply of phytohormones in their diet, which could actually block the negative effects of abnormal levels of either estrogen or testosterone, and perhaps other hormones as well.
Alcohol should not be used by anybody. The reason is this: 2 to 3 drinks a week is enough to give a woman a 4-fold risk, independently of everything else, of causing breast cancer. So the old cliche about alcohol in moderation is not a good one. 2 to 3 drinks a week, not a day, is enough to give a woman that higher rate of incidence of breast cancer. We do know that alcohol, the dark-colored wines, for instance, will help increase the HDL, the healthy cholesterol. But when those studies were looked at seriously, and from what country? France, they found that France has the highest, 6th highest rate of cancer in the world. The dietary factors that can help prevent breast cancer include a low-fat diet, like avoiding all red meats and all dairy products, both of which have high fat. Even skim products from the dairy products are not so good because they also do other things that we don't like in humans. But fatty food should be avoided at all costs. We need to increase our soluble fiber and insoluble fiber. So fresh fruits, vegetables, and cereals should be part of everyday's daily diet all the time.
Well, let me first mention the fat that isn't beneficial. That's what's known as a trans fatty acid. Margarine is one of the major sources of this trans fat. And basically, that trans just refers to the structure of this fat, and our bodies have a difficult time getting rid of it. And on a cellular level, these trans fats make cells very rigid. And an increased intake of trans fats is directly correlated with a higher incidence of several types of cancers. On the other hand, beneficial fats would be monounsaturated fats that you get from plant foods, like avocados, for example. And having more monounsaturated fats and polyunsaturated fats, which you can get from grains, for example, and have that be the overriding types of fats as opposed to saturated fats, which are from animal products.
Antioxidants such as beta-carotene, vitamin A, vitamin B6, vitamin C, vitamin E, zinc, selenium, glutathione, and many others are critically important for preventing cancer, because what they do is to actually attack and consume those precancerous kinds of cells that occur in all of us. So it's very, very important that nutrition be part of your strategy. And don't just use a single vitamin or a single mineral or a single botanical, but instead look at a balanced combination so that you can get all of the benefits in the way that they've been shown in studies to be most effective.
Melatonin is a very potent antioxidant that should be part of a woman's regimen, particularly after the age of 35 or 40, when breast cancer starts to increase in incidence. Melatonin protects against breast cancer. It decreases breast cancer cell growth in cultures. As we get older, our melatonin levels naturally decline and breast cancer increases. It's interesting that melatonin's suppressing growth in breast cancer cells can be interfered with by electromagnetic fields. That's one reason we want to stay away from EMF. It's also known that drinking alcohol also increases a woman's estrogen level, giving her a risk factor for breast cancer, and alcohol also decreases the nocturnal release of melatonin.
I really often am concerned that we have to get our nutrition sometimes out of a bottle rather than out of our foods. But consider this, if we were out hunting and gathering and doing the things that our bodies are really designed to do well, we would be eating 4,000 or 5,000 calories a day of very good, wholesome food that had all of its nutrients. Instead, most of us are dealing with sedentary or at least partly sedentary jobs. We don't get the exercise because we don't have the time, and the food processing system has really removed a lot of the nutrients that we depend on for our systems in our bodies to work properly.
Exercise can stimulate the body's natural killer cell activity. Natural killer cells are those immune cells that fight tumors. Something that can impair the body's natural killer cell activity and immune function is having excessive levels of blood sugar. When the blood sugar goes too high, phagocytosis, which is the process of immune cells engulfing cancer cells, becomes impaired. Exercise and blood sugar control both relate to stress in the body. When the body is under stress, the immune system becomes crippled. And here at our center, we measure the body's response to stress with a special saliva test. From the saliva, we measure levels of cortisol and DHEA. Cortisol is a catabolic hormone, which is necessary in certain quantities in the body. However, under stress, when cortisol becomes excessive and DHEA is produced at suboptimal levels, then the immune system shuts down. So part of our program involves normalizing the body's stress response and enhancing the immune system through these methods.
Phytochemicals are really fairly new in terms of nutritional therapies these days. Over the past 5 years or so, the awareness of phytochemicals or plant chemicals in foods that have very profound effects on just overall health and biological function are being studied vigorously now. Phytochemicals literally means plant chemicals that would either cause direct effects in the body in terms of immune enhancement or other enhancement of bodily functions, or actually resemble hormones, which in terms of cancer is a good idea because phytochemicals that look like hormones can block negative effects of hormone levels in persons with cancer.
Cancer prevention is probably the most important part of what I do in my practice. For patients who have already had cancer and are now in remission, the most critical issue is to not walk down that path again and have a recurrence. There are a number of things that I do, but if I were to give you one single best piece of advice, it would be to not depend on one particular strategy, but instead to look at all of the positive natural things that you can do to not have a relapse in cancer.
I'd like to point out that mammography isn't prevention. Mammography is claimed to be early detection. But in fact, by the time you pick up a tumor on mammography, that tumor is about 6 to 9 years old. So it's not early detection. That's the first point. Now, the premenopausal breast is very dense, and it's highly sensitive to radiation. So when a woman goes in for a mammogram, she gets roughly a quarter of a rad. A rad is a radiation measure of exposure, for each film. Now, if she has, say, 4 films per breast, that's 1 rad, so it's 1 rad for each breast, and over 10 years, that's 10 rads per each breast. And now we know from studies by the National Academy of Sciences going back to 1971 that for every 1 rad exposure, you increase risk of breast cancer by about 1%. So the risks which a woman would have from annual mammography, premenopausal mammography for 10 years, would be about 10%, which is very substantial. And in fact, many women have more than 4 films per breast, which increases the risk still further. Now, these considerations are further strengthened by the fact that we have a series of studies, American and European studies, which show that women that have routine premenopausal mammography have an increased risk of postmenopausal breast cancer after the premenopausal period.
The good news is this: if we make a concerted attempt to cut the dose in half or to a quarter and still get whatever medical x-rays are needed, we can look forward to many millions of cancers being prevented. We should start now. The reason for starting now is this: cancer doesn't come in 2 weeks after a cause, or 2 months, or a year. When you irradiate someone, the cancer from those irradiations, the cancer comes 5, 10, 20, 30, 40, 50, even 60 years after the radiation.
So for all these reasons, one can say that A, premenopausal mammography is not early detection. It's not effective because you miss about 1 in every 4 breast cancers with premenopausal mammography because of the density of the breast. And again, 3 out of every 10 women are falsely diagnosed with breast cancer. So it's not early detection. It's not effective. It carries high risks. We're dealing with a multi-billion-dollar scam. The machinery currently costs about $4 billion, and with new digital mammography, we're talking about up to about $10 billion for procedures that really aren't effective, and they're unsafe, and there are safe alternatives, namely breast self-examination. There's no evidence that mammography is in any way superior to breast self-examination, particularly breast self-examination by a woman trained in this procedure, and particularly by a woman who uses what's called a sensor pad, a pad which you can get out in prescription, which you lay on the breast, and after a training, you can very easily train any woman to detect a lump greater than about 1/4 centimeter, which is roughly in the same order that you can detect them from mammography.
So a screening device, screening tool, mammograms are only useful in women aged 50 to 65, probably. When you look at that age group of women, a screening tool like a mammogram is effective at prolonging lifespan. Under age 50, 40 to 49, the most vocal group in the women's advocates have been shown not to have any benefit at all in a screening mode. When one biostatistician was asked how many days or how long a woman would live longer if she used a screening tool every year from age 40 to 50, the answer was 7 days longer, 7 days of length of time. So it really is not a very important screening tool at all. The most important screening tool is a good examination by a competent physician. Now, what is a competent physician? We know that the OBGYN doctors, who are the frontline defense, who examine more breasts than any other doctor, have been shown in at least one study to be 5th on the totem pole at finding lumps and masses in the breast. The study just shows that if a doctor spends time looking for lumps in the breast, any doctor, a general practitioner, a surgeon, an internist, it doesn't matter, the longer they spend in looking for a breast lump, the more often they will find it.
Part of the reason we've lost the war on cancer lies in the strategy of the people who are leading the fight. Their view of the disease is determinedly myopic. To them, cancer is a localized disease represented by the tumor. By cutting it out, poisoning it with chemotherapy, or irradiating the tumor, the traditional oncologist attempts to kill it in order to save the patient. The allocation of research funds depends upon who controls this battle. Unfortunately, the same small group of individuals and institutions, only about 30, have virtually monopolized, for the past 40 years, the entire budget of cancer research. They dictate who gets what. Hence any new innovative therapies suggesting that cancer may in part be due to our thoughts, our polluted environment, our adulterated and denatured diet are excluded from funding.
In the 1970s, it was Nixon that coined the term war on cancer. It was recognized that cancer was a big problem, and at the time it was thought that viruses were the major cause of cancer. So to be a virologist at the time was very well looked upon. But the thinking was that if we could put a man on the moon with that great knowledge and technology, perhaps if we could have that same level of technology, the war on cancer, we could find the cause of cancer. But we know now, at least the overall type of thinking is that there isn't a single cause or factor of cancer. Viruses certainly have some role in certain types of cancers, but certainly so does genetic factors, and so does our stress levels, and so do our individual needs for certain nutrients. So I think the problem with this war on cancer concept was that its focus was still on treating cancer once you had cancer. There was no emphasis whatsoever placed on the prevention of cancer. And I think that's the most important area to focus on, prevention.
The message that women get from the cancer establishment, that is the National Cancer Institute and the American Cancer Society, is clearly that there is no way in which a woman can reduce her risks of breast cancer. In fact, in the 1997 American Cancer Society Facts and Figures, they say specifically there is no way in which a woman can reduce her risks of breast cancer. And the National Cancer Institute, in fact, the Presidential Commission of the National Cancer Institute, states categorically that breast cancer is not a preventable disease. And the object of this book is to give lie to these very misleading assurances and to show there are many, many ways in which a woman can reduce her risks of breast cancer.
One thing to keep in mind is you have almost two scientific traditions. You have big science and little science. Big science is the expensive, well-funded clinical trials that appear to be definitive and that will sway medical opinion. But the people doing alternative therapies are people in the little science tradition. They don't have access to the money. A lot of their products are non-patentable, so they can't attract big money to support it. But they still produce some kinds of evidence. They have good series of case studies, and they have good retrospective outcomes analyses. So the evidence is really pretty good when you consider the political economy of cancer.
There's the question of beware the doctor, beware the cancer establishment that tell you that oral contraceptives are safe, that estrogen replacement therapy is safe, and that premenopausal mammography is safe. So we're trying to empower women to ask questions and not to accept medical authority blindly, and to realize that there are major conflicts of interest in the source of all the medical information in this country. All the OB-GYN doctors, obstetrics and gynecology doctors, get their information from two sources, either the PDR, physician's desk reference, which is the manufacturer's information on drugs which trivialize these risks, and also in the American Cancer Society is, I would say, in bed with the mammography industry, the multi-billion mammography industry, the machine industry, the film industry, and the radiologists.
In the history of cancer therapies in this century, the radiation therapies emerged before chemotherapy. The radiation therapies emerged around World War II, and chemotherapies after that. And radium therapy was quite a big business. Several of the large hospitals in the United States practice radium therapy, and it became a big moneymaker for these hospitals and for the doctors who were involved in it. They didn't really want the competition of less toxic approaches such as immunological and nutritional therapies. If we go to the period after World War II, there's a new overlay in the cancer industry, and that is the chemotherapy industry. And that emerged partly due to people like Cornelius Dusty Rhodes, who had served in the US government as head of chemical warfare and brought that experience back into cancer treatment, basically treating cancer as a chemical warfare problem. And Cornelius Rhodes was quite opposed to the bacterial and immunological treatments for cancer. During the 1950s, Cornelius Rhodes actually closed down the use of Coley's toxins that had remained at Memorial Hospital. And he also led to the end of a grant that would have been very important for Virginia Livingston, who had an autogenous vaccine therapy for cancer.
Most of the research is dominated by drug companies seeking enormous profits to gain back their investment of over $200 million in patentable drugs. In order for them to do that, they need to seek huge profits. And you can't blame them, but the kind of therapies that are available to the public that are insurance reimbursable nowadays are very toxic. If you try to discuss with your oncologist alternative approaches, he would consider it quackery, unscientific, and unproven. And the history of alternative therapies to cancers is sad because it's reached both extremes. It's either been totally repressed with lack of research, or it's gone to the other extreme where there are unfathomable claims of cure with no substantial research. The pendulum needs to swing toward the middle right now.
Anybody who tries to do anything regarding alternative approaches has to fund themselves. That's a major point. We have to pool our information, and again the problem is that many of these protocols and many of these types of treatment have to be funded by the patients themselves, and again the products that are used cannot be patented.
The history of bacterial vaccines is very interesting because they've been around for about 100 years, and they were gradually pushed out of cancer treatment in New York and in other cities, first by the emerging radium and X-ray and radiation therapy industry, which really became an industry unto itself, and then later after World War II by the emerging chemotherapy industry. And there are very specific cases that I talk about in my book, Can Bacteria Cause Cancer, that document how these very promising bacterial vaccines and treatments were suppressed by an emerging cancer industry.
Needless to say, in just one segment, we can't handle everything on cancer, so we'll return next week, sharing more in our continuing series on cancer, natural approaches. I'm Gary Knoll. Thank you very much for watching.